My name is David Corbin and I live with mental health day to day. It's a fascinating role and I think no 2 days are the same. Very, very rarely will I go into work and stick to the same routine. As well as the day-to-day running, you have the constant engagement from staff on matters of support that they need or queries that they're raising. I'm not the font of all knowledge, but I have the key to most answers. So if I don't have the answers on the end of my fingertips, then I can normally quite easily source them or find them and then share them with other people. I think for me the most important thing is I see my 6,000 staff as being the public as well. So they're not, for me they're all service users as well. So they have lived experiences, and if we can get it right for our staff and show that our staff that we care and are trying to do good for them, then hopefully then that sends out the right messages to the public and to the community. I think the earlier we get people talking about situations when they're in difficulty, the better. The support that's put in place to try and support people is essential. And also the fact that when people do get to talk about things, that they're not made to feel bad, that it's a supportive rather than judgmental support that's put in place. So regardless of what the situation is, the easier people find to talk about it, or the quicker people can talk about it, then the quicker they can get measures put in place to try and support them. And there isn't always an easy solution. And I think sometimes what we get is multiple situations that develop, and then people are caught in the headlights and they're not sure which way to turn or which way to go for support. And then just by talking to somebody else and unpicking some of that, getting to the root cause of it, and then seeing what steps can be put in place to try and mitigate some of the pressures. Some of it is real, and some of it is perceived. It's making sure that we make a clear distinction and we put the right support in place at the right time. There's a real battle, I think, to get parity between physical health and mental health and the way that it's being treated. And I think nationally that's a real driver.